this side did not get Ashley's information, so you want to tell them where?
So it's a really ugly form. Usually I try to give more white space and make it look prettier to the eye, but you can visit h4ml.org and then click on the button that says blog, and it'll be the most recent blog post. I need to update the website because for some reason it's not rolling over. There's also a web address if somebody wants to, actually, there's a web address here if you want to take a picture of it. And you guys can get that handout. It just goes over the talking points and the things that I talked about in regards to Johnson County opting out and how to have these conversations with your county commissioners and your legislators. So what I really try to do is break things down because, did you have a question? Oh, okay. Politics is hard and it moves at the speed of light. There have been many times where I kind of felt like I was being spun around in circles, and these bills are super long, so it makes it really hard to discern what's going on, who do you trust, and I really will give the legislators a little bit of slack, which is uncharacteristic of me, but I will give them a little bit of slack because things do change super fast, and they aren't, I mean, I was focusing on this bill and maybe 3 others this session, and things change so fast. If you're not directly involved with that bill, it's hard to keep up. But that's not an excuse for voting wrong. And I'm really thankful. Scott and I just had a little bit of a conversation about that. And I think his eyes were open to the fact that if you don't agree, you need to vote no. You need to vote your conscience. And so I'm going to continue to have that conversation with him. And I'm going to encourage all of you to do the same. Because, or if you have a different elected official, or maybe somebody like JD who doesn't recognize those issues, who's maybe been a little bit more beat up by the establishment, the House party, you need to be having these conversations. So one of the things that we're doing as an organization right now is developing the Watchdogs program, and I've talked about this before, but we are at a pivotal point right now. Things are really interesting. Hoosiers for Medical Liberty, as many of you know, started in 2020. Right before COVID, I went to a political class and learned that I could be mean to people who are, betraying us and not doing the right thing. And I was like, sign me up. I want to do that. Can I have that job, please? And I'm very good at it. But if I don't have to be mean, I'm not going to be mean. I want to see them succeed because that means that we, as citizens, succeed. So, I went to that class on February 1st, and I filed the paperwork for our nonprofit on February 8th. Sat down with a lawyer on a Saturday and filed the paperwork. Game on, okay? We truly need to make politics something that we all can be proud of. And the way that we do that is by having regular conversation with our legislators, or any elected person for that matter, and then holding them accountable when they vote the wrong way. J.D. Prescott had a primary challenger last year. He is on his best behavior as far as voting because he knows that there are people out there, like myself, who are going to take those votes and say, look, you noticed he brought those vote sheets today? Did you notice? He brought them so you could all see them because he knew that I was going to call him out if he did the wrong thing. This is how we get things done. Now, on the opposite end of that spectrum, I had a great conversation with Mr. Moore. When we have legislators who are consistently, not occasionally, consistently doing the right thing, we give them solid ground to stand on. We help them do their job right. It's not, oh, my elected official knows what I want. They'll do the right thing. Because guess what? They have a really difficult job down there. I don't envy them. Although I am great at debate, I don't envy them because they have a lot of pressure coming at them down on the State House floor and in those private caucus meetings that we aren't privy to. So we need to have them know that when they are doing the right thing consistently and being brave and pushing the hard issues, that we are going to be here to support them. Now, Hoosiers for Medical Liberty does not support, endorse, or oppose any political candidate, but you as constituents can. And they just have to know that it is conditional. They are your employee. They are your employee. You get to manage them. And that's what we're doing through the Watchdog program. I'm working with an amazing volunteer who has some experience in interrogation. This just comes natural to me, I'm blessed. But I want to develop some classes so that way our watchdogs are prepared, not to go in there and lambast them, but so that way you guys can identify when they start feeding you lines, when they start spinning you in circles, because you know politicians do that. Okay, so we want to give you the tools to create a government that you can be proud of. And that's our Watchdogs program. You can go to h4ml.org/watchdogs, or you can text us. We do all of our legislative updates through text message because they're super quick, and I just make it so you can tap the phone number and call the legislator, and I give you an example of what to say. The Watchdogs program will be operated very similarly to this, except your responsibility is going to be to go meet with your legislator in person 1 time a year. Not too bad, right? I want you to also have 2 to 3 other sessions of dialogue, whether that's in person, whether that's via email or phone. They need to know who you are, right? Because this is how we create that employer-employee relationship. This is how they know that you're going to maintain watching what they're doing and accountability. And then we want you to come back and tell us what you're hearing. Now, if you have been part of, I know Janet can testify to this, part of our tactic is using those text messages to mobilize you guys and make those phone calls, because you're at work, you're doing things, the holidays just got over, maybe still in a turkey coma, and it's difficult to keep up, but with those text messages, it makes it really fast. When you give us information back about what's happening, that helps us gauge the climate down at the State House. And that can be invaluable, because then I know where to turn up the heat and where to back off, who to be nice to, all those kinds of things. And so this is going to be a key part moving forward. I mentioned the Bodily Integrity Act. All other legislative actions will be secondary to the Bodily Integrity Act, okay? If we can secure our bodily integrity, we don't have to worry about these mandates, because it will be illegal in the state. Whew, wouldn't that be great? Not baloney exemptions that leave a lot of people out. Did you have a question?
Yeah, do you have any legislators that are working with you on this that are willing to put it forward? Possibly?
We're talking to a few. Right now, everybody's a little gun shy. And even the legislators that I thought were going to be our champions are preoccupied, is a nice way to say that. So that's frustrating, and it's a matter of changing culture. That's what we're in. We're in a cultural war, and the culture down at the State House is comply or you get nothing. And so part of me has an empathetic side for these individuals. The other part of me says, you went in knowing what you were getting into, suck it up and get to work. Maybe that's a little bit too farm girl, but I don't really care. We gotta fix this mess, and we're losing ground in so many places. If we have security at our county level, our counties can tell the feds to take a hike. Do you guys realize that? So that's why this is so important. And I feel bad for these guys a little bit, because I'm not sure that they knew that portion about the code was there. I'm not sure that they fully grasped the ramifications of that. And then if you want to get into the psychological aspect, we talk a little bit about you know, if I accept this is wrong, I have to take responsibility for it, and that can be very difficult. So they're in a tough position, but no more excuses. They know now, and now they need to do better. End of story. So, Watchdogs, I really want to see this program up and running. We are going to be pleasant because you don't treat your employees like dirt, right? You want to praise them. Maybe praise is the wrong word. You want to let them know when they've done a good job, and you also want to hold them accountable when they're not doing their job, like hemorrhaging money at the seams, and your restaurant is now going to have to, you know, charge $20 for a side salad. For a side salad, sorry, my bad. Does anybody have any questions about what's happening or want to talk about anything? I'd like to have this be dialogue.
I do. So, do you want me to have the mic? I got to run in laps.
Just want to be sure everybody can hear
Okay, thank
all
you.
the conversation.
First of all, thanks for what you do. I've spent time kind of digging through legislation, all that stuff. I know it's difficult, can be a little tedious, not always fun, but it's important that someone does it. I guess my second question is, or I guess my question is, while we're talking about medical liberty, last year's House Bill 1001, 2022's 1001, the COVID bill, I had a talk with my representative, and he informed me that I was lying about people losing their jobs because of that bill. With you being the director of Hoosiers for Medical Liberty, have you heard of people losing their jobs because of that bill?
Yeah, it's a sad state because they have, and this is where it's interesting because these legislators will say, well, you have a choice. You can get a job elsewhere. What? So, yes, I have heard of people losing their jobs. I have had students contacting me from very prestigious schools, and what's interesting is these schools, they are at the highest levels, okay? Very difficult to get into. One student had a full ride scholarship, and this actually is not medical field, but they weren't denied entry based on the COVID vaccine. They were denied entry based on not having their childhood vaccinations. And so this student is giving up a full ride scholarship, facing the choice between giving up a full ride scholarship or getting a massive amount of vaccines that they may or may not need. I mean, the right to bodily integrity is such a fundamental premise, and we see this idea bastardized across the board. And yet, in this most fundamental form, we can't have the right to say no to something entering in our bodies. How does that work? So, the beating around the bush, yes, I have heard that. And, you know, unfortunately, it seems like your representative has a really big issue with confrontation or maybe having to admit that he had done something wrong. I would have a lot more respect, you know, if he, first of all, how can you know that nobody lost a job based on that? It's not reasonable to think you would know everything. And so why create such a big stir over that? Does he have a guilty conscience? Is that what's going on? I don't know. I can't speak for him, but yes, there have been lots of people who have lost their jobs over this, and they continue to have issues with this, and I think we're going to face another round. And it's really interesting because that bill, I believe, was specific to COVID-19. Mm-hmm. And so if they name it something else, are we going to be back in this whole situation? Like, heaven forbid, some other illness pops up, or we're going to be back in this situation where we're fighting for our bodily integrity. And that's why we have to have the Bodily Integrity Act. We need to nip it in the bud. We don't need to be going and picking like little birdies at this problem because it's going to be continuous. Any other questions?
Just a comment. One of the biggest problems you have, and I expressed this to the representative, and that is the constant change in definitions. That's what they do. Dead serious. It's bait and switch. And therefore, because of the new stats are put up based on a false premise. And the COVID-19 is a prime example. When you have swab tests that are 95% false positive, and you get $8,000 of federal money for every new one, everybody's got COVID, and all those graphs aren't worth the paper they're written on.
Yeah.
This is the difficulty. And we're seeing this over and over and over in changes in definition. Now, I was here back in February in regard to child gender change. Believe it or not, that went on pretty far. And in fact, I testified for the Ohio House in regard to gonadotrophic analogs. And they keep changing the field. For instance, the actual number of people, percentage-wise, who are not heterosexual is about 3%. Always has been. You're not gonna change that. That goes back to the Sumerians and before. Okay? That's fine. If they're over 18, that's what they wanna do, God bless them. However, now they've changed the definition to 7%. And it gives them more weight. One of the things that I was expressing this on is the chart that was handed out here. And you thought you had problems getting the paper. Where Indiana is below the national average, okay? This was actually put on at the Ohio Bureau of Workers' Compensation Symposium. Unfortunately, Vivian Heimlicher passed away. But I said her, said she could, and it's free, by the way, and it's for employers as well. They showed how this is set by zip code, and it has to do with how you tally. So don't let this graph be completely believable. That's the difficulty you run into. I mean, you can make a statistic lie left, right, and center simply by changing the definition.
Or data points, I mean, moving the goalposts.
And that, yeah, you move the goalposts constantly. And this is what we're seeing over and over and over. So I'm here to take back to Ohio what I'm learning here. Because if it's here, guess what's coming next? And I do stay in contact with legislators over there. Anyways, I gotta get rolling myself, but you hit that dead on the head.
You know what, thank you so much. I just appreciate you being a doctor and here and just being so brave.
Do you know how many people who testified for child butchering actually had the material I gave you? They took actual ethics course? No idea. No idea. I gave you a canon. All you had to do was find an attorney who would be willing to look into it. None of the opposition had the ethics. And yet we started out with eugenics, then we went on to Nuremberg. They say, oh, you're stopping the kids, you're a Nazi. No, that's what we hung the Nazis for. And don't forget, Winston Churchill was forcibly sterilizing the poor in London at the very same time to eliminate poverty. And the Nazis were right, they were doing the same thing. FDR had the M Project for the quote-unquote Jewish problem in the United States. He was gonna put them in Patagonia, take Uganda, make that the new Israel, etc. That was all in the works. Then we went on, of course, to Tuskegee, the Latino contraceptive studies, into Belmont, which has Section D for protection of children. Nobody, these are laws on the books. And nobody wants to take a look at the laws in the books. So that's why I'm here tonight.
Thank you, Dr. Lindquist. Unfortunately, Dr. Lindquist is in Ohio. But he came all the way over this evening to hear and to provide some information for us too. So thank you, Dr. Lindquist.
I appreciate all of you, I really
Okay.
do.
Yeah.
And like all these groups, we gotta get younger people in here.
Yes.
We really do, because that's the future.
Yeah.
Thank you.
Thank you. Okay, Ashley, I wanna see about 5 more minutes for questions, and then I want us to go over what the information I got from Jamie, and, you can
You're gonna
respond
put me on
to
the
that.
spot, huh?
Well.
Turning the tables.
I mean.
That's fine, I'm just teasing.
Yeah, that's what
Yes.
you do.
That is what I do, isn't it?
So, okay, anyone else have any questions for Ashley right now?
Right up front here.
Right up front here.
Oh, hi, you're right here on the front row.
Just because I'm short, Margaret. I don't know if you can answer this, but you touched on a real soft spot with me. I've been reading a lot about preventative medicine. And you've heard Dr. Kenneth Cooper that has the aerobics down in Dallas. He does preventative medicine, and I read a lot of his articles. And, you know, he has been preaching to the, well, not even to the choir, he's been preaching for years upon years about prevention. And that most doctors won't go with that because it's not as dramatic, you don't make as much money, and all of that stuff. And he talks about lifestyle, and that's what he does. When he doctors someone, that's exactly what he does. He does the nutrition, he does the, you know, just everything. And it bothers me that that's what we do. We've got Big Pharma, who now has control of the so-called studies that are done academically with all those ties, and they can put out whatever they want, they can change whatever they want, and they get money, and they hand it out to the doctors. So they're not, I even have friends, they have real serious medical issues. She goes from one doctor to another, and all they do is run a test or two, give her a different medicine. They never go after the problem. It's just let something go down her throat and that's it. How in the world are we gonna get Big Pharma out of that? And the legislatures, you know, they're the ones who also get backy, just like the teachers' unions and stuff. How do we do that?
It's a cultural change, just like everything else, it's culture. So it's talking to your grandkids, it's getting them involved not only in politics, but in healthier life choices. When I worked for a major insurance company, and my job was to call senior citizens, anybody on Medicare, Medicaid, with that company, and work with them to decrease their risk for going back into the hospital and improve, you know, compliance and things like that. And you know, it's very hard for me to work in a traditional setting because I see how these things make such a difference. That's always how my family was. You know, my family was very, very much active and real food, healthy food, good food. And so it comes naturally for me. And when I see these patients, you know, in the hospitals eating these meals, it kills me because I'm like, oh, well, no wonder you're back. Oh, you went to KFC? Huh, that might have a little bit of sodium in there. But when I worked at the insurance company, it was amazing because I was really able to sit down and talk with my patients about what was going on. And one of the biggest things is it's hard to be healthy. It's hard to be healthy. It takes work every single day. And so when the medical industry started going to take 2 aspirin and call me in the morning, it was easy. All of a sudden we have this quick fix for all of our problems. And why would we want to invest? You know, we're all busy. We all love our American dream and doing all the things. And, you know, Aunt Sally makes this great, you know, turtle mousse pie or whatever. And you know, we can find all these excuses. Oh, it's okay, I'll just go to the doctor and get Ozempic for my diabetes and I'll lose 45 pounds because that's what the commercials tell me. No, that's not how it works. And by working with my patients and getting to the root of the problem, not necessarily just with their health challenges, but what was preventing them from an emotional and psychological standpoint, we were really able to remove some of those barriers. And as they started to implement small changes, we saw dramatic results. I could tell stories about the different patients that I had, but that's one of the things that I would love to start incorporating. Once I get medical liberty taken care of, I will be moving on to healthcare. So these guys aren't going to get rid of me very easily, but I do have my own consulting business, and that's what I work on, is just kind of going through, number one, learning how to advocate for yourself, understanding, wellness 101, what your doctor wishes they could teach you. And when your doctor has 15 minutes to see you in their office, and then they, have to move on to the next patient, they don't have the time to educate you. You also have to be compliant with those health lifestyle changes. And it's complicated because it's not one thing that's just gonna all of a sudden fix your health problems. And so it takes time, and we are weak creatures. If we don't see results right away, we get frustrated and we quit. And so it is difficult, and you can't have your patients in every 2 weeks. There's a lot of things that go into that. So it's a culture change. We need to be having these conversations. We need to be encouraging one another. I think there's a lot of excuses that we can make as to why we don't do things, but sometimes it's just, I talk a lot about neural pathways in my coaching, and I compare it to cow fields because I'm a farm kid. And if you've ever seen a pasture that gets grown up and the cows start walking out to the end of the field, first it's barely, they're barely able to get through. And then as those cows travel that same path, there becomes a path. And that's the way our brains work. So the more we go to these positive places, the more we use these different coping mechanisms, healthy coping mechanisms, instead of the bag of chips in front of TV at night, or whatever the case is, those neural pathways become easier, and you'll default to those rather than the worn path to, I'm just gonna take some insert medicine name to take care of this problem. I know I can correct these behaviors, and you're gonna default to that. So cultural change, having the conversations, encouraging the people around you, and just being aware that we're all struggling. We all have burdens that we're carrying, whether we share them outwardly or not. And so creating that culture of compassion and encouragement is gonna be really key.
The only thing I wanted to add to that is insurance. You know how that goes. I do everything natural, and everything we do goes out of pocket. Went through some health stuff, and if I went the traditional way, I would not be well today. But we did it the other way, but insurance won't cover any of it. So that goes along with it, and it goes back to, like you said, education. People believe their doctors. They go in, the doctor says, I need this, and they walk out the door. I see it with my father. I see it with my sister. She's gone through autoimmune stuff. It's too much money the other way, and it's too hard, and I don't have time to cook my own meals.
So the one thing I will say is there is a parallel system that's popping up and really coming about, and this goes back to the whole research and different doctors and things like that. I don't know that the answer is getting, I don't know that and this is these are my personal opinions right now, not the opinions of Hoosiers for Medical Liberty, because we stick just to that right to bodily integrity. But I'm not sure that the answer is insurance, because then we're just gonna have more regulation on those things, and I really don't want the government telling me what homeopathic remedies that I can use or what herbs I can or cannot use. And so it's gonna be really interesting, and I think the market is gonna shift some of those things. It's been really great to sit on some of these meetings. Because of the work I do with Hoosiers for Medical Liberty, I get to be part of some of these national groups and meetings and get to hear these things, and I do constantly advocate, and sometimes I get pushback for this. I advocate for the traditional system because that's where I came from, and one of my biggest things, my biggest pet peeves, is I refuse to leave somebody behind. And I really think what we're gonna see is if we would just say we're done with the Western medicine paradigm and switch over to an alternative system, we're gonna have people that either don't know, can't afford, don't trust it, insert whatever excuse, and they're gonna be stuck in this Western medicine paradigm. So I think we need to work on creating that bridge between the alternatives and the standard treatments, so that way people can go in and out of those as they please, that we can really focus on these things. I don't know what the answer is right now, but I do think that this is a conversation that is gonna continue to happen, and I think the market is gonna shift automatically. It already has started shifting, people moving out of traditional insurance companies, moving into cost sharing plans with a physician, different things like that, different co-ops, and just all sorts of really cool stuff happening. So I think that cultural change is there, and I've been working with a crew of different physicians and other researchers that are working to put out unbiased information. And I kind of have a hard time saying unbiased because I think we all have our own personal bias, but these people I know have it in their hearts that they just want the truth out there. They want the information so that way people can make an informed decision about their health care. And that's ultimately what it comes down to, because my choices are going to be different than yours and yours and yours, because we're all individuals and we've all had different experiences and circumstances, and that's the way it should be. So
I'm gonna have one more question, and I'd like to make it short.
we'll make sure we
Yeah.
get those things
Well, I have
answered.
some people who are here especially to hear some of the things that are on Jamie's,
Okay.
Here we go.
Well, I wanted to say one thing when she was talking about the doctors. They are trained by pharmaceuticals. And where the pharmaceuticals, this is their mindset. I mean, I have doctors, I have nurses in the family, just like my daughter. She will eat things and I'll say, that really isn't good for you. Mom, the first thing they taught us was a dietitian part. And so, anyway, then I'll explain to her and all, and she still is so programmed that this is her mindset, and it's like we need to start with the pharmaceuticals and start making it hard on them, however it's done. But, and educate the doctors, because they are programmed. And it's just, and I did everything natural for 32 years. And you was talking about on TV, I go to herbalists here. There are herbalists that right here, they will test you and tell you what you need from time to time. Yes, it's expensive, but nobody was more poor than me when I started it, and that I make because my health is worth more than anything else. And so, I mean, I don't know, maybe I'm wrong, but to me, start with pharmaceutical to where they stop lying, just like with the diabetes, their diets for diabetes is all messed up. And if you go into take the classes and you question them, then they get angry with you and won't let you speak.
Okay, I saw one, Carolyn, can you do it real quickly, cause we need to move on.
She's gonna time you 30 seconds.
Good luck.
Give money to the universities and the educational places. Now, if we could get, companies that do, sell like herbs and things like that, give them money to, maybe we'd have it for them. There's one person that was sick.
It's gotta be consumer demand.
Her doctor said they only had like 3 hours in nutrition in their study.
And then it's wrong.
Yeah, there are so many issues with the medical system, but I think the thing that we need to focus on is the fact that there are a lot of doctors out there. Doctors and nurses don't typically, I mean, there are always gonna be some that'll prove me wrong, but typically they do it because they love their patients and they want to take good care of them. And so as they see these things, they'll start coming around. We have to meet them with compassion and love. I'm currently writing a book on not just blatant, what is that word? Where they just, amnesty, no amnesty, but we need to meet them with love and forgiveness, because they're really gonna struggle as they recognize the things that they've done over years, decades, has caused harm. And I struggle with that personally. And so, and that's why I'm writing a book on it, is because it is difficult to think that everything that you were taught was wrong. Lots of work to do, one bite at a time, bodily integrity first, and then we'll go on to healthcare. Let me see these recommendations.
Okay, well, this is an outline, some of the ladies back there want this information. This is, it's divided, at least 60% of the money that we get it must be spent for preventive core services. And the other 40%, let's see here where we are.
Here, I'm gonna borrow this and read it.
Well, I need it.
You just need to sit down.
What do they say about bears? Back away slowly.
Up to 40% of funding can be spent for core services. So I wanted to go through quickly. These are the ones on that have to be spent for preventive core services. And the first one is tobacco prevention and cessation, chronic disease prevention, trauma and injury prevention, fatality review, maternal and child health, school health liaison. That's one of the things you were asking about. And he has descriptions on here of what is included in those, if you have a question about that. Lead case management and risk assessment, access to and linkage to clinical care, tuberculosis prevention and case management. Health-related areas during emergencies and disasters, immunizations, infectious disease surveillance and prevention, vital records, food protection. You know, I skipped over somewhere into the 40%. There's a 60. See where the 40% starts. Environmental, public health, let's see, maybe it's on here. Yeah, here it is. Up to 40% of the funding can be spent for these services. Food protection, environmental, public health, tattoo, body piercing, eyelash safety, and sanitation.
The eyelash safety.
And so, I don't know, when I went through those lists, I thought, how do you make people stop eating too much? How do you keep them from getting fat? I don't know, maybe there's a way. But here is, did any of you have any questions about any of those titles that you want me to elaborate on what it is or what they can do?
Tell us about tattoos.
What?
Eyelash safety.
The tattoo parlors are something that already happens. It's just the sanitary inspection to make sure they're not reusing needles or have infestations or things like that. Because if you use dirty needles, you have the risk of transmission of bloodborne pathogen, and that increases your risk for the community as a whole. So those are things that have been long-standing. And I mean, eyelashes cracks me up because when we had SB 74, the first year we were around, they heard eyelash extension bill and they made it so that way anybody without a license could do it. Like they didn't have to have a license to add eyelash extensions instead of hearing our bill. But those are things that should be like, there needs to be a little bit of oversight, I think, on making sure that we're not using dirty needles in tattoo parlors and stuff like that. Those have been there. That's
one of the things that the things that I thought we would like to know is, and it was included in the letter that went to Jamie, will a review of grant requirements be done to ensure entities receiving them are held accountable for meeting metrics and providing public health measures, not chronic disease management? Your constituents deserve to know that when the county contracts with local businesses, the businesses will be held accountable to provide appropriate public health measures. And this is Jamie's response. SEA 4 requires the posting of any job openings and any contract opportunities to occur for a minimum of 30 days prior to fulfillment. Any contracts that are entered into under this funding will be presented to both the Delaware County Board of Health as well as the county commissioners for approval. All funding distributed would come with requirements and deliverables. Metrics and measures would vary based on the agreement in question. For example, if we contract with an agency to provide health screenings or to provide vaccines at a remote location or to host trainings or education to the public, it would be difficult to specify the number of clients served, as that variable would be determined by public interest and subsequent participation in the service provided. At this time, we are unsure what amount, if any, would initially be utilized in the form of grants. So does that?
Yeah, you heard right there those magic words, population served. That's the metric they're using, not the rate of diabetes, not the rate of a heart disease, not childhood obesity. Now, I will say, one of the things that I talked about when I testified down at the State House is these things take a long time to measure. It's not gonna change overnight. These things do not, by nature, change overnight. And so that was one of my issues and why I suggested a grant program, which they claimed that they did, but they completely bastardized the idea. If they had set goals and they were using this to where counties could apply and then they had kind of a plan set up, you would have more control and accountability over that. And what we're gonna see is every county is gonna do something drastically different. We're not really, if there is any positive effect out of this at all, it's gonna be difficult to tell, and it's gonna be different in every county, and how they measure that is important. As Dr. Lindquist was talking about, you can skew data. My job at this hospital as part of coordinator for the heart failure program was data specialist. And so I was pulling data from patient charts and I was synthesizing that data, and it would be very easily for me to manipulate those numbers based on different variables. And that can easily happen here. So we made a really bad investment, and only time is gonna tell if we will ever recover this money or if it's gonna be fruitful, or if big hospital woo-woo is gonna get just their pockets padded and be able to continue to do the same things with no change in results. And that's what's frustrating to me, is because we really could be using this money for public good, and instead we made in the words of our lovely legislators here, we made there was not much good to this bill. I mean, I do understand, and I think that having these metrics, some of them sound good, but you can have a great tool in the wrong hands and it be used as a weapon. And I think that's what we've done here. And what is it, $150 million, $75 million for the first year, $150 million for the second. And the other thing is these legislators, not necessarily these ones right here, but these legislators are going around, and even if they voted against the bill, they're telling their constituents. I was there at DeKalb County when Senator Johnson told the constituents and his county commissioners, I think we should take this money because otherwise we're gonna leave it on the table and it's gonna go to another county. Don't do that. You are part of the problem. Leaving money on the table is not an excuse to do the wrong thing. If we go back to that idea of lemmings jumping off the cliff. And so it's really frustrating, and I pray that good comes out of it. I'm sure at some level we can find the silver lining, but we need to make sure that this doesn't continue, and we really have to work to hold these legislators accountable. And that's the only reason these guys are scared of me. I was really surprised that they showed up. I prepared a whole thing to talk about tonight because I thought they wouldn't show up. And
They're not that kind of legislators, I'm sorry.
I don't know them, so I don't know if they'd show up if they knew I was gonna be here again. I don't know what's gonna happen, but we have to continue to hold them accountable. This is what it takes. They have to be willing to do this thing, and I appreciate the candid conversation that I had with Scott. That was great. That is what we need. So they're not afraid of me because I am whatever, insert adjective here. They know that I can communicate very well with you guys, and that you guys will act on the information that you're being given. That for whatever reason, you have chosen to trust me. I am being a voice for the people. So if you guys quit doing what you're doing and you don't step up the game a little bit, if you haven't already started meeting your legislators, they're gonna see me as empty threats and a big mouth. Seriously. So I need you guys. This organization is run by people like you, by a gentleman by the name of Rod in Wayne County, who is just lighting things up over there, and I'm really, really proud of him because he's doing it on his own accord, and he'll come back and we'll have some conversations. But going over things like this, having these conversations, this is also important. So I want to thank you guys for being here tonight. I want to thank you for having faith in what I'm saying and investigating, questioning what I'm saying to make sure it's right. Make sure you agree.
Oh, I just wanted to mention when she was going through that list of what the money was gonna be spent on, and like Dr. Lindquist said, the definition, and then I'm hearing chronic disease immunizations. Well, right there is a tie right there. And what kind of propaganda are they gonna use to, and it's worrisome.
So our focus really needs to be on securing bodily integrity.
Yes.
It's really, truly, we cannot accept anything less than bodily integrity. There's a lot of things, the things that flag me the most, the school clinics, the school liaisons, going in, there's been a lot of talk about, we need to regulate these school clinics. And while I think that there should be rules, I'm scared right now, we don't have anything in our law that is regarding school clinics. Okay, there's nothing in there. My concern is that if we start regulating school clinics and we start putting it into code, schools are gonna be required to have some sort of clinic. And even though we go in with our best intention to put safety rails or guardrails on these school clinics, we're gonna end up, we watched what happened with 2022's House Bill 1001. We were asking with SB 74 the year prior, we were asking for no vaccine mandates for vaccines at all in the workplace. Their response back was, let's just regulate it. Let's make exemptions. And that bill got worse and worse and worse, and they were trying to do as little as possible. And then the noisy voices of the pharmaceutical industry, the hospital industry, the federal government got their way. And so we had exclusions from exemptions. Wrap your mind around that. Exclusions from exemptions. So people were excluded from being able to file an exemption, okay? Including hospitals, federal contractors, entertainment industry, and there was like a list of people who were excluded from being able to file an exemption. And they created so much regulation in there, and they added discriminatory testing twice a week. So if you exercise your right to religious freedom and to reject a vaccine based on your religious beliefs, they now can discriminate against you by testing twice a week. And that's what happens when we try to regulate these things. So there's talk about regulating the school clinics. We just need to say no. Keep the clinics out of the schools. No school clinics, period.
Right, yes.
Not guardrails, not safety nets. No.
Yes.
Off-site, parental,
Yes.
That's taking
parental
rights when
they're in
the
Yes,
You don't have a clue
right.
what that school
yeah,
is.
and
Yeah.
this is gonna become a very hot issue, and this is gonna be one
Our
that we're gonna talk about.
our time runs out at 8:30. I have one question here, and then I wanted to leave you with a figure before you go.
I wanna know about the illegals. How many illegals are in Indiana? How many of them are in Delaware County? And they're gonna be a drain on our resources. Does anybody know how many are here?
That's not an issue that I follow,
Really?
sorry. Yeah, there's only so many hours in the day, and I am a crazy person, and I do a lot of work, and I get a lot done in a little amount of time, but I can't tackle all the issues.
Well, we've heard, reports that they brought a lot of, diseases in that we had already conquered. And would that be a health issue in our county?
Tuberculosis has been around, and it circulates anytime there's migration. You know, when we think about these issues, it becomes very muddied very fast, and so I'm hesitant to get into it. But what I will say is we have to remember, my family immigrated, you know, there are a lot of good people that are in bad situations. My family went from Auschwitz to Egypt and passed through a bunch of different countries, and then when they got to the US soil, they were told that they had too much Nazi influence and they couldn't come into the United States. So Mexico set up a village, and that's where they landed. My family had to work very hard to come into the United States, get a sponsor, do all these things. Good people can come through immigration. And we have to remember that our right to bodily integrity extends not only to just citizens, but that's a human right. And so there's a lot of really touchy subjects there. That's all I'm gonna say, is bodily integrity is a human right, the right not to have to accept.
We'll have to have Ashley come back when we just have her by herself and she can have the whole time, but it is time for us to leave, but I wanted to leave you with some figures here. This concerns the 25% copay, which we would be responsible for. And for the first year, the minimum money that we will receive is $1,300,872.38. The maximum is $1,734,496.50. And the county's match, an average of county tax levy related funds distributed to the local health department in the preceding 3 years, which would be 2021, 2022, and 2023. And I don't know what that is at this point. In 2025, the minimum, because we just have figures right now for 2024 and 2025. In 2025, the minimum is $2,601,744.75. The maximum is $3,468,993. And the county match minimum, it would be $545,527.13. And the maximum for the match would be $727,369.50. So that's a pretty big amount of money that we're gonna be responsible for. And it has to come from somewhere. It cannot come from federal grants. It cannot come from fees that they've already collected or that they normally collect. So it has to come from somewhere else, and that somewhere else often is taxes.
So, this is me doing their job, right? When I looked at this for a few counties, and I actually talked to I always say the assessor, but I'm pretty sure it's the auditor. I think I have it right this time. When I talked to the auditor, the numbers for the county match seem to coincide pretty closely with what your budget is currently. And so I don't anticipate a huge tax increase, but it is concerning, what is this gonna do? How is this gonna change in the future? And I don't know the breakdown, so I don't know how much of that budget, actually, when I talked to DeKalb County, they said that's what they allotted, their county, that's what came out of the county tax amount. And so those two numbers, what you would be expected to pay for your county match, and what your county had already put into the health department, I believe excluding any grants or things like that, was very close to your county match. And that's why this is such an impossible thing to pass up. Because you're putting in the same amount as a county as what you had in the past, but you're getting this additional $1.3 to $1.8 million for your county this year, and then that goes up next year, and there will be an increase in what you're required to pay next year. But again, I think, I don't know what that discrepancy is, and so that's what you'll wanna look at as far as your increase in taxes. So I wanna be very clear, right now, I don't think you're gonna look at a tax hike because of this. And that's what makes it so difficult to pass up, is because they knew going in, they were gonna have to set the stakes high. And I will brag on our activists, the people that fought against this. They did a great job, because we really stopped them from making it a mandatory across the board for everybody. And there were a couple other things that we did to walk them back on their coercion. So you guys did a really great job.
Right. Okay, well, thank you very much, Ashley. I hope you'll consider coming back and
Of course.
seeing us again. And thank you, everyone, for attending.